Okay. So this is the question of writing, and in OET writing we have 5 minutes for the reading the question and 40 minutes to write your answers. So in that, when you got your writing, writing question paper, first of all you need to read the writing task, our task. What is our task? So in this, you know that using the information in the case note, write a letter to Mr. Andrew Williams, West End Home Healthcare Agency, 62. Okay, so address also they are given, like uh, yeah, address of that recipient address is given, and on behalf of Mr. Thompson, requesting a home visit to provide service such as wound care, medication, administration, and assistance with mobility. So some of the services like wound care, medication, for all these services, the patient need a home visit. For that home visit only, we are writing the letter to the home care agency. This is our writing task. I hope you people are clear about the writing task. Now we can read the case note. So in this, from this case note, we need to select the relevant data and we need to omit the irrelevant data. So today's date they have given 17 to 2021. So we are writing the letter on 17 to 2021. So Mr. David Thompson is a 48-year-old patient. So it's a male patient. It's a male patient, and age also given 48-year-old patient in Carewell Hospital, where you are acting as a charge nurse. So we are the charge nurse and we are taking care of the patient. And in the patient detail, name of the patient is given Mr. David Thompson. Age also has given age 48-year-old. Date of admission 15 February 2021. Date of discharge 19 February 2021. And in the diagnosis, acute cholecystitis with the gallstone. So diagnosis of the patient is acute cholecystitis with the gallstone. And patient has a allergy of penicillin. Patient is allergic to penicillin. These are the basic information regarding the patient. Now we are moving to the social background. So in the social background, which are the important details? Patient lives with his wife and 2 young children in a suburban home. Work as a construction manager, currently unable to work due to pain. Patient is currently unable to work due to pain. That we need to select, because that nurse should need to know regarding the mobility and also working condition of the patient. And active lifestyle, enjoy playing sport, hiking with his family. It's a relevant data because that nurse doesn't want to know regarding the habit of the patient. When it comes to the next, no history of smoking or alcohol abuse. Patient didn't have the history of smoking or habit of smoking and alcohol abuse, so doesn't want to write in the letter. Patient has a family history of diabetes and heart diseases. Next one, that is a semi-relevant data. Either if you want to write, you can write, or doesn't want to write. In the medical background, no major medical history prior to this admission. So before this incident, that means before the admission, patient doesn't have any kind of medical history. So we don't want to write it. Second point, well-controlled hypertension with medication. That hypertension is under control with the medication, that we need to write, because it's an important data and patient is taking the medication for the hypertension. And coming to the current presentation, so after admission, patient is admitted with a sudden onset of severe right upper quadrant abdominal pain, nausea and vomiting. Patient got admitted in our hospital. What are the complaint? So complaint is severe right upper quadrant abdominal pain, nausea and vomiting. Patient has a pain described as constant, sharp and radiating to the right shoulder blade, and no fever, chills or jaundice. So patient has the pain. The pain is very constant and it is radiating constant and sharp, which is radiating to the right shoulder blade. These are the pain. And in the physical examination, it revealed right upper quadrant, tenderness, and Murphy sign. So that also we need to write. Okay. When when they have done the diagnostic procedure in the abdominal USG, confirmed presence of gallstones and thickened gallbladder. Complete blood count shows slightly elevated white blood cell count. Liver function test mildly elevated. So anyway, patient has diagnosed with the what? Gallstones. So we need to only mention that UST regarding the abdominal UST. You can write the remaining. These are the remaining points are the semi-relevant. Okay. And in the treatment plan, intravenous fluid and pain medication. We have during the admission we have treated the patient with the IV fluids and pain medication, antibiotic for the potential infection, laparoscopic cholecystectomy. They have done the surgery. And what are the nursing management? As a nurse, what are the how we care the patient? So we have monitor the vital signs daily and pain level, provide nausea and vomiting medication as needed, offer clear liquid and advanced diet based on tolerance. And we have already educated the patient about the surgical procedure and post-operative care, provided emotional support and address any concern. These are we have already done during the hospitalization. And what is a plan? Plan in the sense what why means that the recipient, what are the things that need to done by that recipient, that is the person who doing that home visit. So first point, follow-up appointment with surgeon first week after discharge. After discharge they need to do a follow-up appointment. We can just like not it in that letter, but that recipient doesn't want to know regarding the follow-up appointment. And dietary modification to avoid fatty and spicy food, pain management plan established before discharge. So regarding the pain management, only that home care service should do, and other things we can just like notify. We can give a notify to that person. And regarding the administration, assistant with the mobility, all those details we can write to the recipient. So this is the question. We need to, from this point, we need to frame the letter. Okay. So when you are writing your OET letter, first of all, you need to write the date. What is the today's date? Just a minute. Okay. So today's date we need to mention. Either you can mention the today's date or the address first. Today, here I am mentioned the date first. So 12/5/2022. Then I have mentioned the address. Aged Care Manager, Aged Care Agency, NSW, Australia. And salutation. Dear Sir. Dear Sir or Madam. You can write Dear Sir or Madam. Okay, then comma. It is not compulsory to put comma. Okay. Then after that, we need to write the referral. In the referral, we need to write the patient name and age. So here you can write Mr. John Peter, age 76. Sorry, it's a wrong. Yeah, yeah, this is the right. This is the correct answer letter. Sorry, it's a misunderstanding. Sorry, everyone. Okay, so we need to write the date first, then address. Mr. Andrew William, West End Home Healthcare Agency. So address we have already wrote here. Then salutation, dear Mr. Williams. So either you can put comma or doesn't want to put comma. you can write the salutation, and then after salutation you need to write the referral. So here referral Mr. David Thompson, 48-year-old. So regarding the patient details we have wrote in the referral detail. After that, we need to write the introduction paragraph. First paragraph, we are called as the introduction paragraph. In the introduction paragraph, it is compulsory to put the patient name and the purpose of the letter and the diagnosis or the current status of the patient. So here, our purpose is writing to request a home visit. Home visit is our purpose for Mr. David Thompson. So name of the patient, who is currently under our care at Cable Hospital. He is scheduled for discharge on 19 February 2021 following a diagnosis of acute cholecystitis with the gallstone. So this is our diagnosis. So current status of the patient. So acute cholecystitis with the gallstone. See, this acute cholecystitis with the gallstone doesn't want to capitalize. So you can write the small letter acute cholecystitis with the gallstone. So please note that in the introduction you need to write, it is very compulsory to write patient name and purpose of the letter. Then you need to write the current status of the patient. So that is about the introduction. Then the next paragraph, that is body paragraph. In the body paragraph, you can write the present details of the patient. In that present details, what are the complaint of the patient and what diagnostic procedure we have done and what kind of treatment we have done during the hospitalization and what progress patient has made. All those details we need to cover in the body paragraph. So you can see that Mr. Thompson experienced sudden and severe right upper quadrant abdominal pain, nausea, and vomiting before admission. So before admission, patient has these symptoms. And upon discharge, treatment plan then upon diagnosis. So upon diagnosis, in the sense during that diagnosis, treatment plan consisting of IV medication. That is based on this diagnosis, the treatment plan, we have done the treatment plan. It is consisting of IV fluid, pain medication, antibiotics, and laparoscopic cholecystectomy was implemented. So currently his vital signs and pain level are stable. That is the progress of the patient. And also a dietary advancement plan is being followed. That also we have included in the first paragraph. Okay. Then coming to the next paragraph, Mr. Thompson worked as the construction manager. So this paragraph is in this paragraph we have included patient symptom and the treatment histories. So diagnosis is only that abdominal USG only important point, but after abdominal USG only gallstone. We have diagnosed with a gallstone, so that is a semi-relevant point. That's why we have omitted that data. Okay. After that, we have done that what social history. So Mr. Thompson worked as a construction manager, lives with his wife, two children in the suburban home. So since it is a home visit, that's why we have included all these details. He leads an active lifestyle involving sport and hiking, which will be temporarily restricted post surgery. So we have already told that it's a irrelevant data, but you can write in this way, which will be temporarily restricted post surgery. His medication history included well-controlled hypertension, managed with medication, and family history of diabetes and heart disease. So hypertension, regarding that hypertension medication, we need to write. That also we have included in this second paragraph. Then come to the last paragraph. Last paragraph we have including in the discharge plan. In the discharge plan, what are the details you need to include, like what are the plan we have already, so in that writing case note that we need to write in the discharge paragraph. So here you can see, yeah, here you can see following discharge. Following discharge, Mr. Thompson will require assistance. Either you can write in this way or you can start. It would be greatly appreciated, or kindly do, or please do. Okay, it's up to you. Both are correct. These phrases are correct only. You can start from in either way. So here I have started this sentence with following discharge. Mr. Thompson will require assistance with wound care, medication administration, and daily mobility tasks. So these points have covered in the writing task. So we just included here. So require assistance with wound care, medication administration, and daily mobility tasks. He will have a follow-up appointment with the surgeon 1 week later. He requires dietary modification to avoid fatty and spicy food. So I believe your agency service would be instrumental in ensuring his smooth recovery. It is optional. Either you can write or skip it. Okay. This is how we need to write that OET letter. So in the closing, sincerely, comma, it is there. So once you have written, once you have wrote this, dear Mr. William, so we didn't put the comma here. Okay, we didn't put the comma here. If you put comma in this dear after salutation, after that surname of the doctor or surname of that person, you need to put a comma here also. Sincere, after sincerely. So this is the one type of letter, and after that, and also I have written a different type of letter after that. So you can refer this letter and write it in your own way. Okay, clear?